L&R USA Inc. is a global medical device and supplies company with a 160-year history of designing and manufacturing innovative compression therapy and advanced wound care products. As part of our commitment to provide the best possible compression therapy solutions, we have prepared this video demonstrating the measuring guidelines for L&R's TributeNight custom therapeutic nightwear compression garments, part of the Solaris collection of garments and wraps by L&R. All TributeNight garments are custom designed and fabricated for style and donning preferences. The measuring positions indicated on the order forms are for reference only. Use your professional judgment. The most appropriate measuring locations will vary depending on your patient's presentation. As you take each measurement, record it in the appropriate space on the order form as shown. And remember, all measurements are taken in centimeters. Since TributeNight garments are most commonly worn while the patient is sleeping, we recommend measurements be taken in a supine position. If necessary, measurements can be taken in standing or seated positions, but always indicate on the order form the position in which the measurements were taken. In extreme presentations, measure the lobules, breast, or pannus in a supported position. Note that when skin folds are present, measure the largest girth. Additionally, you may measure the circumference under the skin fold. If there is girth fluctuation, indicate the girth range on the form as shown. With the patient in a supine position and legs adducted in a natural relaxed posture, begin by marking all length reference points on the lateral leg. You will use these marks later as a reference when measuring circumferences. Place a pencil or dowel at the groin and have the patient hold a tape measure as a visual guide if needed. A length is measured from the heel, indicated on the diagram as 0, to the determined distal position. If you'd like full foot coverage, measure to the tip of the great toe. Record your measurement on the order form. B length is measured from the heel, 0 position, to the determined B position on the lateral side of the leg, which is typically the largest girth point of the ankle. Measure the C length from the 0 heel position to the determined C position, which is typically the largest girth point on the calf. D length is measured from the 0 heel position to the determined D position just below the patella. Measure E length from the 0 heel position to the mid-patella or determined E position and record. F length is measured from the 0 heel position to the determined F position, the largest girth point of the thigh, and record. To determine the lateral leg length, measure from the 0 heel position to the determined G position and record. To determine the medial leg length, have the patient hold the tape measure at the groin on the medial side of the leg and measure to heel or 0 position. Record on the form as mg length. H length is measured from the 0 heel position to the iliac crest. Record the determined H length. For garments ending at the I position, measure from the 0 heel position to the natural waistline. Record on the form as shown. For J-length garments, consider crossing the transverse plane or watershed, or you can customize the J-length to meet your patient's needs. To determine the AS length, have your patient hold the tape measure and measure from the mid-crotch to the anterior natural waist. Record your measurement. With the patient continuing to hold the tape measure, determine the PS length by measuring from the mid-crotch to the posterior natural waist. Record your measurement. Now with the patient again in a supine position with legs adducted in a natural relaxed posture, measure circumferences at the positions you marked previously. To determine a circumference, measure the circumference of the foot across the MTPs and record. Measure the circumference of the ankle at the determined B position and record. Measure the Y circumference diagonally from the 0 heel position over the anterior foot back to the posterior heel. Measure the C circumference of the calf at the marked C position. measure the D circumference at the marked D position just below the patella. Measure the circumference at the marked E position or mid-patella and record. To determine F circumference, measure at the marked F position on the upper leg. Measure the G circumference straight across at the level of the groin, being careful not to angle the tape measure on the lateral side of the thigh. Measure the H circumference across the hips at the marked H position, which is usually across the iliac crest or the largest point of the hip. Record your measurement. The I circumference is measured at the natural waistline or the determined I position. Record your measurement on the form as shown. Finally, measure the J circumference at the determined J position and record your measurement on the order form. Your measurements are now complete. Next, you can choose to customize your garment further with modifications and design. At L&R, we are committed to helping your patients receive the full benefit from their 100% custom TributeNight garment. We hope this video has provided a user-friendly guideline for measuring with L&R's forms. Should you have any questions regarding a custom design or selecting a style of compression garment for your patient's individual therapeutic needs, our Design Center team is ready to help and available by phone, email, or video conferencing. Thank you for your continued business and for choosing L&R USA Inc.